I'm Dr. DeAndrea, and I'm going to talk to you today about the 28-week packet that you've received. This is the 28-week video where we'll go over the information that's important for you and your baby at this point in your pregnancy. The first thing I'm going to talk about is childbirth preparation classes. There are childbirth preparation classes that are available at the hospital at the Education Center. The course they have will review the childbirth preparation, breathing methods, pain control, epidurals, and what to expect while you're in the hospital, before and after the baby is born. During one of the classes, you'll meet with a local pediatrician, and you'll also tour the birthing facility at the hospital. We recommend you enroll in the course and take it. I find that the more information someone has about labor and delivery, the less anxious they tend to be. The phone number to register for the birthing classes is included in your packet. At this point in your pregnancy, we all want you to begin to prepare for the birth of your infant. We encourage all new moms to consider breastfeeding. Breastfeeding has been proven to have significant health advantages for both you and your baby. There are breastfeeding classes available at the hospital, which you can take before your baby's born. The phone number to register is the same phone number as you would call for the birthing classes. The nurses at Carteret General Hospital are also specifically trained in breastfeeding support in the newborn period. They can help while you're in the hospital. There's also a program at Carteret General Hospital where nursing staff is available to help you with breastfeeding when you go home with your newborn as well. If you have any questions about breastfeeding, please don't hesitate to ask your providers. Movement. In your packet, you'll find a kick count sheet. We ask that you begin to pay attention to fetal movement from approximately 28 weeks forward on a daily basis. We're looking for your baby to move 10 times or more in the course of 2 hours. Set aside a time during the day when your baby's most active to pay attention to him or her. Each time your baby moves, you check one of the boxes on the sheet. Once you feel your baby move 10 times or more in the 2 hours, you can check that day off and concentrate again on your baby the next day. The kick count sheet included in your packet will help you remember to do this. If you don't feel your baby move 10 times in 2 hours during the day, then we want you to come directly to labor and delivery at Carteret General Hospital. We will then observe you there and monitor the baby until we're satisfied that the baby's okay. We'd like you to start paying attention to contractions. Some of you will have felt contractions at this point in the pregnancy, and some of you will have not. You have a paper in your packet which describes how to identify a contraction and how to time it. If you feel your upper belly is getting hard, and it's hard to press the fingertips into the belly, this is a contraction. Some people describe the feeling as a period cramp, or they tell me they feel like the baby's balling up. When timing contractions, we want you to start timing from the beginning of one contraction to the beginning of the next one. The amount of time between them is how far apart contractions are. You can also write down how long each contraction lasts. Contractions usually last about 30 to 70 seconds. You're allowed to have up to 4 contractions an hour. If you're noticing that the contractions you're having are getting uncomfortable, we ask that you stop your activity, drink 2 large glasses of water, and lay down. If you continue to have more than 4 contractions an hour, we ask you to go directly to labor and delivery at Carteret General Hospital. Go in through the emergency room, and they will take you up to labor and delivery. Once you are 37 weeks pregnant or beyond, we'll ask that you come in if your contractions are much closer together. If you have them for an hour and they're closer together, we'll ask you to come in, but we'll go over that at a later time. For now, you're allowed to have up to 4 contractions an hour. If you have more than that, we want to see you at labor and delivery. In your packet, you've also received a 28-week Staying Healthy sheet. I'm going to go over a few extra things that are on that sheet. The first is exercise. Remember to keep exercising unless a provider has told you not to. Regular, low-impact exercise is great for you in pregnancy, and you'll be in better shape at the time of labor life. We also ask you to eliminate stress and conflicts that decrease your overall well-being. If you have feelings of sadness or hopelessness, please talk to your provider. Regarding weight gain in pregnancy, if you were average weight when starting out your pregnancy, we want you to gain a total of 25 to 35 pounds. Gaining more weight than you should increases your risk for cesarean delivery. A diet heavy in vegetables, fresh fruits, along with lean meats, nuts, and whole grain is recommended. Prenatal vitamins are also still important. Be sure to continue taking your prenatal vitamin every day. In addition, drink milk and other food products rich in calcium every day. If you're not getting enough calcium in your food, add a supplement or even just crunch down a couple of Tums. Smoking. If you're smoking in pregnancy, we want you to stop. Smoking has proven dangerous for both you and your unborn baby. Ask your provider today about smoking cessation strategies. At this point in your pregnancy, the anesthesia physicians at Carteret General Hospital want to meet you. There's a sheet in the packet from the anesthesiologist explaining how to make an appointment. You must have this appointment in order to be able to have an epidural. Even if you're currently planning on not getting an epidural, the anesthesia physicians want to meet with you. Please call the number at the bottom of the sheet in your packet to make that appointment within the next week or so. On the back of that sheet is a map showing you where you need to go in order to have the anesthesia appointment. Remember, when you're at home, please be sure to write any questions you may have for us down as they come up. We're happy to answer questions at any of your pregnancy appointments. Have a great day.